Good afternoon. Everyone is feeling quite nourished after lunch, and we have the distinct privilege of presenting to you after lunch. And we're going to make sure that you don't doze off because we're talking about really important topics as it relates to young adults. I'm Velma McBride Murry, and I'm a professor at Vanderbilt University. And this panel is going to speak to issues of safety and health behaviors of young adults. And as we begin to look at the kind of behaviors and safety issues that we're going to focus on in this session, what is going to be very apparent, I think, to each of you is that many of the issues we're going to discuss as a panel mirror those that are experienced by adolescents. Intentional and non-intentional injuries, homicide and suicide rates, and these are the ones that we see frequently among adolescents, substance use and abuse, violence, and risky sexual behavior and its consequences that lead to several negative outcomes. The panel today, however, is going to focus specifically on intentional injuries, sexual relations and behaviors in relationships, and in drug use. So the two topics that we know are very important as it relates to understanding the developmental patterns of young adults also includes non-intentional injuries, as well as the increased incidence of accidents due to motor vehicle, which was, I think, expressed by one of the panelists today. So we're not going to touch on that, but we want you to recognize that we do know that this is a very important issue, but with the time limitation that the panel was given with very strong directions about how many slides and how long, they're unable to cover all of the issues today. But we have been able to, as we look at the health profile of young adults, it's very apparent that they are really faring worse than adolescents, even though they are also engaging in similar kind of health compromising behaviors. The other issue that seems to be cutting across many of the themes of the discussion is that context matters, and that context, factors, and processes not only shape and influence young adults, but the consequences of the context in which those behaviors occur also predict how well they're going to fare or not fare. And so some critical issues I think this panel will cause us to begin to think about is how well are these young people functioning in the areas that they're going to talk about with regard to safety and health-related behaviors, and then for the audience to begin to think about approaches and strategies that can be implemented through research policy, healthcare systems, through our professional organization and institutions to address and eliminate many of the disparities that have been starkly described by other presenters thus far. I am delighted to bring to you an expert panel of individuals whom I'm looking forward to hearing their presentations as well. The first presenter is going to be Dr. Theodore Corbin, who is a physician at Drexel University. Dr. Corbin.